This is Dr. Andrew Ryan, and we need to talk about the infected total joint replacement. An infected total hip or total knee replacement is the disaster that you hear about from your friends and neighbors. It's the disaster that we as surgeons will talk about amongst each other. Now, these will only happen about 1% of the time in terms of a complete infection requiring all parts to be removed and all parts to go back in. The most common symptoms associated with an infection are pain and drainage. Persistent pain is pretty obvious, and we do expect some degree of pain after surgery, but if the pain gets worse and worse, we worry about an infection, or if the pain never really gets better, again, we worry about an infection. With drainage, fluid coming out through the wound or incision can mean infection or bacteria finding their way back underneath into the joint space. If a wound is still draining 2 weeks after surgery, there's a roughly 50% chance that bacteria have already set up an infection underneath the skin. If there is still drainage at 3 weeks after surgery, it's a roughly 75% chance that you will find bacteria under the skin. These bacteria can set up around the replacement parts and become dangerous to you. And the most effective treatment at that point is to totally remove the replacement parts and then wait 2 to 3 months before putting a full replacement back in. This is serious stuff. It doesn't happen very often, but just often enough. And we think that you need to know what can or might happen so that you can make a better decision for yourself as to whether to undergo replacement surgery in the first place.